Doctors at 5 big hospitals here in the capital have stopped working as of early this morning over school admission seats. Now, troubles that patients will face appear to be inevitable. Our Ahn Sung-jin is at one of the hospitals. Sung-jin, lead us through the latest.
Good morning, Dami. I'm standing in front of Severance Hospital in Sinchon, Seoul, where trainee doctors have staged a walkout starting from 6 a.m. this morning. Now, this hospital is one of South Korea's big 5 hospitals, where more than 20% of the total number of trainee doctors work. These walkouts are in protest of a government policy which aims to increase the quota of medical school places by 2,000 places starting from next week. Doctors' groups argue that increasing the number of doctors would lead to unnecessary medical care on top of a lack of incentives for doctors to practice in essential areas such as pediatrics and emergency medicine. But health authorities said more doctors are vital to keep up with the country's fast-aging population. The number of doctors in the country relative to the size of the population is reportedly among the lowest in the developed world. As these trainee doctors play a key role in medical processes, it's expected to bring many difficulties for patients as surgery schedules have already been adjusted. As at this hospital behind me, there are usually nearly 2,000 surgeries scheduled each week. As walkouts begin today after the mass resignations of trainee doctors, the Korea Medical Residents Association announced that it will hold an emergency meeting starting at noon today, which is in 3 hours from now on, to further discuss responses.
But the government is also staying just as stern as the doctors, urging them to continue caring for parents. Sung-jin, how is the government dealing with their absences then?
About 400 emergency medical institutions nationwide will be monitored 24 hours a day from the National Medical Center. If the gap due to a lack of necessary doctors remains for a longer period, the government also announced that it will start non-face-to-face treatments.
There are 12 military hospitals where emergency rooms are operating. We have also decided to open them to civilians.
Now, the government has maintained its position, refusing to accept doctors' demands and denouncing their collective action as intolerable. It is said that President Yoon said that the medical community cannot defeat the people. The Yoon administration has sent a prior notice to key figures such as the chairman of the Emergency Response Committee of the Korea Medical Association regarding the suspension of their doctor's license. Whether this will be taken as a warning to the medical community will be something to watch out for. That's all I have for you. Back to you, Dami.
All right, Sung-jin, thank you for that coverage.